Hi, I wanted to make a 1 month update about my vision therapy and my vivid vision. 1 month ago, I went to the Netherlands to have a visual assessment with optometrist Rob Gevers, and I started a new course of uh, like official vision therapy under guidance of an optometrist. And I wanted to talk a little bit about the regular old school vision therapy exercises I'm doing, and about vivid vision and what my experience is after 1 month. So when it comes to the old school vivid vision, I'm doing the Marsden ball, lying on the floor, looking up, and have the Marsden ball swing back and forth. So my body is not moving on a trampoline or something. That would be too advanced for the moment. So just lying down, have the ball go left and right, up and down in circles and transdiagonal, and then try to like first only with the left eye and then with both eyes. And some days the central area is nice and single, so my both eyes can track the ball together. But some days it's more difficult, and then I have double vision. So today is a difficult day, for example. So I saw the ball doubling up all the time, and usually it's not. It's a very nice, feels very nice if I have a good day and I can see the ball singly in the central area. That's kind of, yeah, just feels good if you can accomplish the task you set out to do. And then I have four regular eye exercises. So the Marsden ball, then the crosswalk, which is walking back and forth in the room while watching an eye chart, and you're putting your left hand on your right knee every time you take a step, and putting your right hand on your left knee. It's like a full body exercise while watching and reading an eye chart. And with this exercise, the experience is that it's nice when I get nearby and I can make the eye chart single and read the letters well. But some days, like today, I didn't, like at no point the eye chart becomes naturally single, which is just a little bit demoralizing, but you just have to accept it's a difficult day. Then another exercise that I do is using a pen light and wearing red-green glasses, and then first having some physiological diplopia, look far away, have the pen light double up, which is supposed to happen, then look nearby, have the pen light double up behind your target, behind your finger, for example, and then look at the pen light directly, try to have it be single. And I do it with my left hand and with my right hand, and the right hand is more easy for me because on the right side, because of the non-committance of my eye position, like the angle of my eyes, this side is easier to look nearby, and that side is easier to look far away, or maybe the other way around. Wait, let me think. Yeah, so this side is easier to look nearby and look singly. But so the right hand is easier than the left hand, and then to make my body and my eyes interact, it's also recommended to walk around and to do a pirouette to turn around. So then just the movement also helps to single out the pen light when you're holding it. And then while you're looking at the pen light with the red and the green lenses, I should try to see some luster, which should be like a mix of the colors, like an orange color. And I don't really see any luster. I just see like a red and green kind of switching around, or so no real mixing of the colors in my case. And then another, the exercise I had the most dramatic progress during this month. So I open the window, I look outside, I look far away, and I put both of my hands out to the side, and then move my fingers and like use peripheral vision and try to see my hand coming in. And usually when I'm doing it, I can see my hand already when I just look far away. Already now my hand is fully 90-degree angle, so I can already see my hand now. So I feel like I have a lot of peripheral vision if I open up, like if I make an effort to use it. But then, so you do this exercise, just the peripheral vision, and then at the end of the exercise, you bring in both fingers, so one finger like that, and the other finger like this, so both fingers pointing at each other. And then you just keep looking in the distance. So you should be, because of physiological diplopia, your hands should be doubling up. So that's normal, what happens in normal vision. And then you should see 2 left hands and 2 right hands, which if you don't have, like sometimes you have suppression. So then sometimes you only see one hand, like the left hand double, or only the right hand double, and it's hard to see both hands double at the same time for me. And then, so then you're seeing 4 hands, and then there's a way to control what you're seeing, like while you look in the distance. So you're kind of, you're consciously using your visual brain to learn what to see, or to decide what you want to see at this point from the physiological diplopia. So the point of the exercise is to keep looking in the distance, so have your eyes open up and be wall-eyed, and then you have your hands doubling up. And if you're doing it correctly, this exercise, you will see like so the 2 fingers are pointing at each other, but then the double left hand and double right hand, you can decide somehow what you can see. So you can kind of suppress parts of these double images, and you can make it so that you see kind of like a finger phalanx floating in the middle of your 2 fingers, and on both sides of this phalanx you see the fingernails, right? Because one fingernail from the right hand, one fingernail from the left hand. So you're really consciously, while looking in the distance, deciding what to suppress and what to see. And it takes a lot of effort and a lot of attention. And in the beginning it was very difficult, but now, as I've been doing it for a month, it gets easier and easier to just kind of get this result, which is what you should be striving for in this exercise. And then the first time it's very hard to get this result, and like you can barely hold on to it for 1 second or half a second, and then it disappears again, and you see again both hands double, or like a kind of jumbled up hands. But then after a while it gets easier to do it and to maintain it, and then now I can maintain it while also being aware of the environment. So this is really like a conscious visual exercise to consciously use your brain to decide what to see and be aware of both images, be aware of that you're not suppressing and all these things. So that's, this has been the most dramatic improvement. And the other exercise I also improved, but then it's more dependent on the day, if I have a good day or a bad day. But I feel with the Mars the Ball I also improved. And then now talking about maybe I'll make a second video just about vivid vision. Wait. Thank you for watching. See you in the next video.